I'm here to talk about acute respiratory distress syndrome. It is one of the medical condition with devastating consequences. Usually the breathing is usually effortless, but when it becomes an effort, it is called as a distress. That's why it is called as distress syndrome. It's also called as an acute respiratory distress syndrome because it is very rapid. You don't have much of a time to intervene in between, so the action should be quick. It has to be detected early. Why it happens, an acute respiratory distress syndrome? It is usually because we have tiny pockets in the lungs. They are like air-filled balloons. And these balloons, they get filled with the fluids. And there are multiple reasons for that. When the balloons get fluid filled, the oxygenation doesn't happen. The peripheral organs doesn't get the oxygenation, and it will lead to multi-organ failure. There are multiple reasons for the fluid to accumulate in these tiny pockets or tiny balloons. One is the most common one, which is the lung infection, which is also called as pneumonia. There are many other reasons, like whenever the patient has a chest trauma, or can be inhalation of toxic fumes, or it could be because of drowning or aspiration. So all this leads to an acute respiratory distress syndrome. The awareness among acute respiratory distress syndrome is not so profound. So that's why the detection will be delayed, the presentation is delayed, and the treatment is also delayed. So what is the treatment for acute respiratory distress syndrome? Mechanical ventilator is a savior here. It is one of the mainstay of the treatment. Many researchers have shown the settings in the mechanical ventilator is the one which determines which patient lives and which patient dies. And the quality of the care, including the intensive care setting, including the nursing personnel and the doctors, has to be very high to manage an ARDS patient. Any delay or any mismanagement will lead to fatal consequences. The mortality is very high in the case of acute respiratory distress syndrome. In spite of being on mechanical ventilator, the patient can deteriorate, and there are some other maneuvers which are called as rescue maneuvers. These rescue maneuvers can be done on the ventilator, or it can be taken over by another machine. One of the cheap and inexpensive method is recruitment maneuver, where you inflate these fluid-filled balloons so that the oxygenation will be better and the organs doesn't suffer much of a damage. There is a cheap and convenient method. One step further is also called as a proning. Proning is where you make the patient lie down on flat in the stomach and you ventilate the lungs which are not ventilated earlier. Another last method, when all these fails, there is a very extremely invasive and highly with high cost. It is called as an extracorporeal membrane oxygenation, where the function of the lungs will be taken over by another machine and the lungs are kept at rest. But this has got a huge financial burden on the patient's relatives and patients. Among all these maneuvers, the proning is the most effective method, and even the studies have shown that the proning is the easiest way and also the best way to help the patient with acute respiratory distress syndrome. The awareness of proning is not so profound, as I said before, but nowadays it is becoming more and more equipped in all the hospitals. It requires a very trained profession as well as a very skilled nursing personnel also, and also a good education to troubleshoot all the problems.